I know you already did touch on COVID, but another day of high cases today, as has been the trend for the past week or so. So I guess what's your message to people who are kind of losing hope in the way that your government is controlling it?
Right. Well, I think we're up 56 cases. We're up a net of 2 today, if I'm not mistaken, and we are high. We're up over 650 active cases here in the province. So that's the highest we have been. There is a number of recoveries that are occurring now as well, but we continue to have some active cases. And I think the message that I would give to the people of the province is we can control the spread of this virus while continuing to have our schools and our workplaces open. We have proven that time and time again. We have had individual regional outbreaks in the past that we have dealt with in a, to quote Dr. Shahab in the meeting I had with him this morning, in a very surgical way to ensure that we are, we are stopping the spread when we have these small outbreaks. What we have here now is in many ways what I had been speaking about, Dr. Shahab had been speaking about over the course of the last few months with a change in weather. People are coming indoors. We are gathering indoors as opposed to outdoors, and that does increase the opportunity for the spread of this virus. And then we have had a few instances, and rather than just 1 or 2, a number of instances where we have seen up in where I live in the Prince Albert area and surrounding communities, a worship service and a number of cases, and we're into the secondary and tertiary cases from that outbreak, as well as a number of nightclubs in Saskatoon and a few other minor, well, I guess none of them are minor, but a few other smaller outbreaks in other areas of the province, one I believe in Yorkton. In many cases, in virtually all of the cases, not 100%, but virtually all of the cases, they can be stemmed back to an organization or a group of people that are either blatantly breaking the public health orders that are in place, or at the very least pushing the compliance to the extreme edges. So the message I would have for the people of the province is this is time for us to reevaluate. This is time for each of us to reevaluate what we're doing each and every day, how we are conducting ourselves, whether or not we are wearing a mask at the appropriate times, ensuring our proper hand hygiene is there. If there are groups of people that are larger than, we all know what the public health orders are, around 15 people in private gatherings, 30, and some areas where you can have a larger presence if they have the ability to physically distance. But if you find yourself in a situation where the group is larger than what the public health order is, it's incumbent on you to not attend. It's incumbent on you to follow the public health orders that are in place. This is how we are able to, I think I said last night, protect lives and livelihoods here in the provinces by keeping that community transmission as low as we can. 650, we need to come down from that number in the weeks ahead. We're heading in, we came out of Thanksgiving season, we're heading into, before too long, Christmas season, and this would be a very good time for each of us as individuals to pay very close attention to precisely how we are conducting ourselves each and every day. I think you're going to see, and Dr. Shahab, I believe, will be out to speak about this in the next day or two, but I think what you're going to see is, like we have all along when we had an outbreak in the north, for example, and we now have had a number of outbreaks for different reasons here in the province. But with respect to the demographics of the infection rate, we're seeing an increasing infections among youth, young adolescents or young adults. Some of that is related to some specific nightclubs. You're going to see Dr. Shahab, I think, address some of that concern as early as this week, not in a broad-based manner, but in a very surgical manner, so that we can ensure that we are keeping people safe here in the province by addressing where the issues are, as opposed to a broad-based blanket approach. With respect to masking, we've been clear on masking all along. If you can't create that distance, you should wear a mask.
What would you say to criticism that early on in the pandemic, you mentioned the north, you cut off, there were checkpoints there. Now we have more cases, the highest ever of active cases, and as you said, it's around the province. Yet we have only seen one change the public health restrictions of private gatherings. And you mentioned a lot of these problems have started from public businesses. Why not come down harder on them, even temporarily?
Well, I think, some of the fines that have been administered are pretty severe. And I think you see the vast majority, let's use nightclubs as an example, the vast majority of nightclubs are adhering to the public health advice because they don't want to be that club that is a place for spreading this virus in the community, and they don't want the fine. I believe they're administered, if I'm not mistaken, $12,000 or $14,000 fines. That's not a small amount of money. I think how we reacted to, let's use the La Loche area as an example, how we worked with the local community and communities in that area to really control the spread. Given what we knew about the spread, how the virus spreads at that point in time, as we have come through the number of months since then, we do have a better understanding of how this virus spreads. We do have a better understanding of the public health guidelines that do help us in curbing or stopping or slowing the spread of that virus. So we don't have to, in my mind, at this point in time, have a broad-based restriction that would come in, for example, on nightclubs, when the vast majority of the nightclubs are following the public health advice. There may be something within those nightclubs where we can further prevent the spread, something that doesn't impact the business that they are conducting, but does keep their patrons safer. For example, we've all seen the video with respect to the dance floor that was full, and that just isn't on, as we move forward. So I think Dr. Shahab will have, some conversation about this in the next few days. This is one area where we have had some challenges here in the province, and I think you'll see, Dr. Shahab speak specifically to that, and maybe specifically to some initiatives that will, provide for further opportunity to keep patrons safer in those specific situations, and ensuring that those that are offside with the public health guidelines and advice, are being dealt with swiftly.